is
the newest one is the 10.
Yeah. What's up, y'all? So we down here at the radio station, Inspiration, 1050 AM, 103.1 FM. I got my main man, Damian Hoskins, in the house. My man Matt back there producing, mixing it down on the ones and twos. No, I'm just teasing. My homegirl Nikki Bean, who is our host of the show. The show is entitled Your Inspiration Health, and it is sponsored by our healthcare partners, Mercy Health. And we're very honored to be here, so y'all stay tuned. We're going to do a live taping, and let's get it in.
We doing a live taping for you?
Yeah, I'm going to tape it.
Oh, you going to set it up?
Yeah.
I was like, make that record.
I think that's good right there, isn't it? I can see Damon. I can see everybody.
All I see is Damon's head.
I can't see.
I got him. I got the front view, though. They know how good looking he is. They're going to be like, oh, look at that boy. It's Kojo. Dark-skinned boy.
You know, last time I left here, I went to Just Cooking around the corner.
Oh, the food place. Nikki, you better come over here. Matt, you ready?
I'm waiting for Matt.
No, Matt, waiting on you.
So today's topic, quick walkthrough, is going to be
What does health
What's some key
what
points?
does health look like? And I think the main thing is, you know, Nikki, maybe open up with your stuff, and then go into conversation. You know, what does health look like? And I think the main conversation when I think about it is, people have this idea of what it is, you know, to be healthy and fit. A lot of that's associated with aesthetics. A lot of that's associated with outward appearance. And I think we need to get under the hood a little bit and talk about, you know, try to remove some of the misnomers and some of the stigma behind that, and let people know, man, that you need to take, you know, be proud of what you're working with the, you know, and it doesn't hurt to improve it, but don't think just because you see a six-pack, don't get into this thing because you need a six-pack or because you desire to get into that bikini. Like, it's got to be about health and wellness. It's also what health looks like. Health looks like this to me.
Wait, hold all that. Wait a minute. I mean, you done went in.
Oh, okay.
All right, we ready.
You guys ready to go?
Yeah.
All right, stand by, guys. And 3, 2, 1.
You are listening to Your Inspiration Health. I am Nikki Bean, here with Kurt Billups and Damian Hoskins, all sponsored by Mercy Health. Hey, guys.
What's up, Nikki B?
So good to be back. Just a little recap from last week. We talked about a little bit of health and wellness, and today we're talking about what does your health look like, and, you know, what does it mean? You know, what are the stereotypes? What really does your health, you know, look like? Anybody want to jump in and... Jamie, you don't mind if I kick it off?
Absolutely.
I think one of the things when you know, Damien, yourself, and I was, you know, I was ideating over this concept of what fitness looks like. I think one of the things that jumped out at me was, you know, there's a lot of misnomers out there that health or wellness or fitness takes on a particular look, and a lot of people that go into a health program or hopefully a lifestyle change program ultimately involves in that, but a lot of them go into it from an outward appearance kind of conversation. I want the six-pack ab. Right. I want this bigger rump. I want this. I want that. Right. And I think a lot of times we lose sight of the importance of proper eating, the importance of exercise or increased physical activity, the importance of doctor visits, regular visits, right? So you know, I think the conversation ideally for us was about, let's kill some of these misnomers, let's tear down some of this nonsense, and let's really get into what health and wellness or what fitness really looks like.
Right. If y'all remember, like back when we were kids, and I'm talking about late 70s or early 80s, there was this perception that good health looked like a Barbie doll.
Right.
Do you remember that? So like there was this visual perception that beauty and health was personified by that Barbie doll look, that hourglass figure, that slim, everything, right? And then at a certain point, and I would say probably in the last 10 years, you know, the aesthetic of health began to shift. People begin to be more body conscious. You couldn't body shame, like that's a no-no. Folks would begin to use terms like, like thick versus whatever. And so at the end of the day, if all of those things are sort of undulating and changing based on perception, it's still outward.
Right.
And nobody knows whether or not those people who were looking like Barbie dolls were actually internally healthy.
Exactly.
Nobody knew if they had diabetes or hypertension. They were or addicted to some kind of prescription medication or diet pills or and all of those things. Health then has to be sort of identified as, holistic health.
Right.
Not just visual.
That's right.
It has to be holistic. It has to be how your body functions in an optimal fashion, right? And that has nothing necessarily to do. I mean, it obviously is there are some conditions, some weight conditions
Right.
that you have to be mindful of.
Right.
However, internally, nobody can look at you and say you have diabetes or you don't have diabetes.
That's right. That's
Nobody
right.
can look at you and say you have hypertension or you don't have hypertension.
That's right.
You have a history of mental or behavioral health because you can't figure out those things from an outward appearance.
No, I agree. I heard a term, acronym, TOFI. And basically in the health and wellness business or in this area, we use TOFI as thin outside, fat inside. And that goes back to what Damien is saying. Just because a person looks healthy, it's one of those situations, don't judge a book by its cover.
Exactly.
There are a lot of people that maintain a thin look, but also have health complications going on. And so this is neat to get into because now we're talking about anatomy and biology to a large degree. And so, we may all look very similar, but at the end of the day, genetically, we're all different.
All different.
And people come to me sometimes and say, well, Kurt, does that person have a high metabolism or does that person have a slow metabolism? We have to be careful with those conversations because you have different body types. When we talk about the morphology or the study of shape, we look at classic. Damien is what we would consider he's a tall, lean, good-looking brother, right? But at the end of the day, genetically speaking, Damien's body is much different than my 5'6" frame, or Nikki, according to Nikki's doctor, 5'5", Dr. Robinson, 5'5". Yeah, one day I want to talk about how the black man is shrinking in America. So anyway, 5'6" when I was 20, now I'm 44 and I'm 5'5", they tell me. But at the end of the day, no, we have two different frames. Now, I would be considered an easy gainer. Nikki, you would be considered an easy gainer. So we would be what they would call a classic endomorph.
What's an easy gainer?
So an endomorphic body type is a body type that we consider round, softer body. Gotcha. Okay, it's also a body type that we consider doesn't have a hard time or struggles with gaining weight.
Gotcha.
Right.
Gotcha.
Okay,
Gotcha.
Then you have what we call an ectomorph. That ectomorph is what we consider a hard gainer.
Gotcha.
This is a lean. A lot of times on a taller person, but not necessarily on a taller person, okay? There are a lot of ectomorphs that are 5'6", 5'5", lean people, skinny, small people. And so when we look at the ectomorphs, those are your hard gainers. And then there's a middle ground, what we call a mesomorph. And that mesomorph is that athletic type. Yeah. Now, here's the beauty in it, though. So I love to talk, at the end of the day, we're all shapeshifters, I like to say, right? So you tie the morphology into the whole shape-shifting thing. It's almost like we're X-Men, right? We're superheroes, right? We have the ability to change our shape or to manipulate our shape. So I might be a natural endomorph, hard gainer, soft, round body type. However, over years of training my body and manipulating my biology, I have transformed myself into a mesomorph or a meso-endo-mesh.
Gotcha.
And you've seen leaner people do the same thing, where they try to manipulate or transform their body. So, we have to remember, you got what you got. Yeah. Work with what you got. I guess the main point for me is don't allow the physical pieces to get in the way or to cause you to miss the benefit of just living a healthier lifestyle. Right. You know what I'm saying?
Absolutely, and I would agree. So, that's real significant insight because information like that, I think, helps to change the perception of anyone who is trying to live a healthy lifestyle because we're bombarded with visual information all day long.
That's right.
You get thousands of bits and pieces of information from billboards to Facebook posts to all the notifications that come across your phone. And that's an industry. There is an industry out there trying to project what beauty looks like, what health looks like.
And
right?
that's the problem.
And that's
I mean,
the
that
problem.
really is the problem. We take what a magazine says. We take, you know, what social media says.
Exactly.
Like per se on Instagram, I do follow a lot of like fitness things, but I look for people that are more once chunky, you know, or whatever you want to call it, or once what we would consider unfit, you know, just looking at them visually, and then what was the aftermath, you know, what did they do, you know, what was your nutrition? So I always ask them questions, you know. If the first thing they say is, oh, I had surgery, X, I don't even follow you anymore. You know, if you said, oh, I do certain products, blah, 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 I don't follow you anymore either. I look for those people that do it naturally, you know, people that look like me at one time, or, you know, even for me sometime now, well, that's the goal I'm trying to get to. Like, sometimes I'm like, oh my God, look at her butt. What'd she do? You know? She'll tell me, oh, I did squats, or I did this, that, and the third. So it's encouraging for me. But we really do have to get out of this, you know, oh, I see this, or I can look on that wall, look at Sparkle. Oh my gosh, she's beautiful. That's what I want to look like. No, I want to just be healthy for me. And that's part of, I think, you know, knowing your numbers, having that relationship with your physician. One thing I maintain is I always ask my doctor, what's my numbers?
I agree.
Though I am a thicker female, or whatever you may want to call it, all my numbers look good. I don't have diabetes. I don't have hypertension. At one point, I thought I had pre-diabetes, and it shocked and scared the crap out of me because my father was a diabetic, who you would have never even thought was a diabetic. What did I do? I ran to Kurt. Kurt, they said I might be pre-diabetic. I lost it. Went back on my nutrition kick. It was gone immediately. Numbers went right back to normal. Follow your numbers. If you know your numbers, you know it all.
You know what's so funny? I mean, not funny, but you know what's so interesting about that comment? Nikki, I 100% agree with Nikki on a lot of what she said, but it's ironic. So Nikki says she ran to me when she got her numbers. Now here's Nikki, who, like you say, is an easy gainer, has her struggles with going up and down, yo-yoing like most of us do. Same here. Okay, I am a reduced body. Nikki is what you call a reduced body, and any one of us who has ever gained the weight and has lost the weight, you are never the same as you used to be. You will always be considered a reduced body, and so that's part of the challenge of losing the weight. But here's the thing I want to point out. So you take somebody who's healthy. So Nikki and I, after we became really close friends, we're talking about a 5-year relationship at this point. After we and her became friends, she started inquiring about my regular doctor's visits. And I remember the first day I told her, I said, Nikki, I go every 2 years for a checkup. She went in. Bruh, listen to me. When I say went in, I'm talking about, went in, right? Hung up, called back, went in some more. Then called back and had the doctor on the phone, Dr. Ken Robinson, who's amazing, my PCP, amazing brother, does a lot for the community. She bring him on the phone, and he listened to her go in some more.
Yes, I did.
Check this out. But this is the point I'm making. I know we're getting close to our time, right? But this is the point I'm making. For those of us that are practicing healthy lifestyle, it doesn't mean you get to ignore the physician.
That's true.
It does not mean you get to ignore visits. It does not mean you get to ignore the numbers. And so I think what health looks like is walking your butt into the doctor's office, making sure everything's good, not just going off the way you look. I think what health looks like, if you're dealing with something going on upstairs and you know you ain't feeling right and you've been sleeping longer than you should, can't get out of bed, I think it's healthy to go walk into somebody's office and sit down and have a conversation. What you think, bro? You smiling? What you got?
And the only reason I'm smiling is because I haven't been to the doctor in a while, and my family and my you know, they will tell you, and I'm very, very embarrassed about this. So I'm gonna need for y'all to hold me accountable to this, but I'm very embarrassed about this. I was told, I mean, you know, I'm 6'5", 250 pounds, right? I was told at one point, based on some numbers that I had at the doctor's office, you know, 2 years ago, and it was 2 years, that that I was overweight. But if you look at me, you know, I'm 6'5", 250. Like, it's all of my weight is evenly distributed over 6 feet and 5 inches. So at the end of the day, I need to be able to go to the doctor to get more accuracy on my numbers. Now, I have an aversion to the doctor. Most black men do.
Same with me.
Most men do.
That was my problem, bro.
I have an aversion to going to see a doctor. Nikki, please stop looking at me like
that. Was my
because
problem. Oh, she about to get you.
It goes
you in trouble.
back to our first show.
Listen.
Men are chickens. Y'all gotta cut this.
When it comes to the doctor,
Men need to stop being scared.
But you're right. Listen. Okay.
Especially when you are right here in healthcare. Let me go in on you for 5 seconds. You are in healthcare, just like I did with Kurt. If you are in healthcare and then you have somebody that can get you into the office and you've got access to some of the best African American physicians there are in this
100%
city
I'm sorry.
that can relate to you and
Yes.
help you,
Yes.
why would you run?
Mm.
So you just gonna walk around and be sick because you think you look good, because you think you cute, you think you tall and lean.
I call him Boris. That's Big Boris.
That's Ildris.
That is not the reason, but you are right. Listen, and I would encourage everyone who is listening to take this advice. I'm making my doctor's appointment as soon as we get off the air.
She gonna make sure of that.
I'm gonna try to actually get in with Dr. Robinson. I'm gonna change my primary care physician, see if Dr. Robinson can see me.
Ain't no see if, and I'm sitting right here. What?
Or Dr. Melvin.
Or Dr. Melvin.
Dr. Melvin.
So
You
Nikki
get,
Bean is
yeah,
Dr. Melvin,
you
Dr.
get
Robinson's
Dr. Melvin.
physician
Yeah.
manager, and I would encourage everyone to take those steps. But I'm embarrassed because I have not, and I should, because we want to be able to leave healthy legacies. And it's not about aesthetics. It's about feeling good, taking care of yourself. I know this, but I'm a chicken when it comes to doctors. I admit it. I'm a chicken when it comes to doctors. I just took my father to his physical training because he had 2 hip replacements, his second hip replacement. So I took him in there, and it's a vulnerable feeling as a black man to see your own father, right, going through those kinds of things.
doubt.
But at the end of the day, you know, he is making sure that he is going to be around a lot longer for his grandchildren, right? And his hips are, they made of vibranium like the Black Panther. But he went. He goes to the doctor regularly. He makes sure his health is in place. And I need to follow suit. Nikki Bean, I agree, and I'm so glad we're running out of time. Looking at me like this, so I can go ahead and make this.
You better be glad. As we wrap up, you know, I just want to encourage everyone, you know, about today, you know, in regards to what does health look like, what does fitness look like. Fitness is not just what you see, it is on the inside.
Absolutely.
It starts on the inside. We're talking about mentally, spiritually,
Absolutely.
everything that goes on, your thoughts. You know, if you feel like you're having some weird thoughts, talk to somebody.
Absolutely.
Go
Right.
see a doctor.
That's right.
You have to stop being scared. If you feel like you're sleeping too much, if you feel like, you know, when you are out of your norm, Damien.
Absolutely.
When you are out of your norm, you know, that is when it's time to go see someone. Don't be scared. Any last words, fellas?
Nah, it was beautiful.
Great conversation.
All
man.
right, it's
Appreciate
been
it.
real.
Stop yelling
We'll see
at
you
me.
guys next time. You're listening to Inspiration Your Health, sponsored by Mercy Health Physicians, Mind, Body, and Spirit.
So tape that last part one more time. You're listening to
What was it? Because
your Inspiration Health.
Your Inspiration
So
Health.
all right, do the close one more time, Nikki.
And you're listening to Inspiration Your
One more time. Ready, Nikki.
Wait, what is it?
Your Inspiration Health.
Okay, right.
Ready and
You are listening to Your Inspiration Health, sponsored by Mercy Health Physicians. I'm Nikki Beam, sitting here with Kurt Billups, Damian Hoskins. We will see you guys again really soon.
that's perfect.
All right.